Hello, I'm Victoria Di Benedetto, and today I will be talking about pulmonary precautions in occupational therapy. Learning objectives. So in order to drive your learning during this PowerPoint module, I have created some objectives using Bloom's taxonomy. So the first one is the learner will define the role of OT in pulmonary care. The learner will identify pulmonary precautions for COPD and COVID. The learner will summarize compensatory techniques for COPD and COVID. The learner will discuss the impact of COPD and COVID on occupational performance. The learner will demonstrate competency in pulmonary precautions during patient care. OT and pulmonary care. So this slide comes straight from our framework. And I thought this was a great place to start because this is the foundation of our practice. So according to the fourth framework, practitioners in the field of occupational therapy are responsible for having a general understanding of the respiratory system functions and how they influence quality of life and occupational performance. So some of the things that we are considering and honing in on during patient care are those vitals, so maintenance of blood pressure, heart rate, O2 saturation, respiration, one's physical endurance, aerobic capacity, stamina, and fatigability. So really just looking at all of these components and most importantly, educating our patients on all of these because when we're not with them, they're going to have to monitor their vitals and understand their limits regarding fatigue. COPD and COVID-19. So these are the two conditions that we will be addressing today when we talk about pulmonary care and OT. So COPD is a group of lung conditions. So this can be emphysema, chronic bronchitis, and they influence one's ability to breathe due to narrowing of the airways and damage to the lungs. So again, this is a progressive condition. And COVID is a disease caused by SARS virus and can cause respiratory complications as well. And we will be talking about how these two pulmonary conditions are very similar in the way we treat our patients. So the photo on the right compares a healthy lung to a lung with COPD. I thought this was a great visual representation to compare the two and noticing how severely impacted these individuals are. So just looking at the alveoli or the air sacs and how in a healthy lung they can expand and they collapse with each breath. In contrast, somebody with COPD making it hard for them to exhale. So that air being trapped in their lungs. So this kind of relates to why we perform the interventions that we do. All those breathing techniques, the diaphragmatic breathing and the pursed lip breathing, which we will go over in further slides. COPD and COVID continued. So I thought it would be beneficial to compare them. We kind of went into the physiology of COPD and how it affects some of the anatomy, and same for COVID-19. So both of these conditions do affect the airways and cause shortness of breath, and both conditions cause less oxygen to enter the bloodstream. So again, those same signs and symptoms we would see, which we'll go over in the next slide. But I thought this was very interesting. According to the Institute for Quality and Efficiency in Health 2020, 8 out of 10 people with COPD who have had COVID-19 died. So going back to the last slide, knowing how their lungs are already compromised with this condition, as well as having COVID on top of that, you could definitely predict how deadly that would be for an individual who contracted COVID and had COPD already. Signs and symptoms of respiratory distress. So starting with dyspnea, this is one of the most common. So this is difficult or labored breathing, And a lot of individuals with pulmonary conditions have this at rest. So just being aware of what their baseline is prior to engaging in any physical activity. The next one is extreme fatigue, non-producive cough, confusion, and cyanosis. So that is a bluish tone in their skin because there is not enough oxygen in the blood. Pulmonary precautions for COPD and COVID. So these are all of the precautions that we will be discussing today that I found important in my personal patient care experiences, as well as what's evident in the current research today. Monitoring vitals. So according to Shah et al. 2017, the most important vitals for detecting pulmonary distress are oxygen saturation, respiratory rate, and pulse rate. Another thing to consider when dealing with pulmonary patients is monitoring their blood pressure as well. With oxygen saturation, the norm is 95 to 100. Patients start to become a concern when they are de-escalating to 92 or less. You would want to stop activity immediately and monitor them. Again, being close to a bedside or a chair just to ensure safety. Also, with this population, you would want to educate on the use of the pulse oximetry. That is a picture of it on the left there. That is my personal one. I always advocated for patients to get their own if they didn't have it, and just educating them on the importance of checking their oxygen saturation throughout activity, and if they're feeling any shortness of breath. I did this a lot throughout treatment, and managing O2. So if somebody is on liters of O2, making sure that you have a portable tank prior to the start of treatment, and also educating the patient on a wearing schedule and the importance of wearing their oxygen throughout ADLs and IADLs. That's if it's applicable, if they need it during, let's say, their showers or when getting dressed, stuff like that. Just making sure they are abiding by what they need in order to maintain that lung capacity. Monitoring vitals continued. So some of the other important vitals to monitor are respiratory rate, heart pulse rate, and blood pressure. So the normal range for respiratory rate is 12 to 16 breaths per minute at rest. Unsafe is 40 or more breaths per minute at rest. For heart rate, the norm is 60 to 100 at rest. Unsafe is 120 or more. For blood pressure, the norm is 120 over 80, and unsafe would be a systolic of 180 or greater and a diastolic of 110 or greater. Another important thing to consider is the MAP, which is the mean arterial pressure, and the norm for that is 70 to 100. And this indicates that there is sufficient pressure for perfusion of O2 into the organs. So that's definitely something to monitor. An unsafe MAP score is 65 or less, and also a score of 90 plus can be indicative of sepsis. And to gather the MAP score, you would take the diastolic times 2 plus the systolic divided by 3. Monitoring vitals continued. So what are MET levels? So MET stands for metabolic equivalent, and it basically indicates as activity increases, more oxygen is needed to meet the demands of the task, whether that be an ADL or IADL, and they are numbered. And for the sake of this presentation, we will be going over 1 through 7. And basically with this, just noticing the common trends here. So from 1 to 2, this is mostly seated ADLs and IADLs. So anything like eating while seated, washing your face, brushing your hair, and a transfer from bed to chair. 2 to 3, you're going to see seated and standing sponge bath and seated warm shower. So notice it says warm because anything too hot or too cold will allow the heart to work harder, and that's definitely something we don't want for our pulmonary patients. And then 3 to 4, we start with the standing showers. And another example would be bowel movement on the toilet, and an IADL of making a bed, sweeping, mopping, and 4 to 5, you get into the hot standing showers and bowel movement on the bedpan, and then IADLs of changing bed linen. You can kind of understand the trend here. And then 5 to 6, sexual intercourse, biking, so definitely activities that require way more oxygen than those seated activities. And 6 to 7, walking with braces and crutches, also consider like a brisk walk, and IADLs of swimming and skiing. So definitely way more high intensity than where we have started. So this is definitely just something to consider when working with cardiopulmonary patients, especially if they are at a specific MET level and you're supposed to follow that during your treatment session. Conserving energy. How can we suggest ways to reduce activity demand? So this is definitely a big part of our wheelhouse as OT practitioners, just finding a way to simplify and modify tasks to fit the needs of the individual. So for our pulmonary patients, on the left here, these are just some good examples of ways you could modify some ADLs. So simply just sitting while completing them, and a handheld shower head too is a great way to be seated while taking a shower and still have that hose to reach all the areas of your body. And a bench in the shower is a good option. Also a patio chair if you wanted a back in there. And then also just educating our patients on incorporating rest breaks to avoid exacerbations, so they know themselves better than we know them. So just definitely educating them on the importance of realizing when they're at that point that it's too much for them, but to try to plan prior to that point so they don't reach that experience of becoming shortness of breath and having to get further care there. Also, plan, prioritize, and pace. This is something I always told patients in the hospital. Something simple as getting your clothes out the night before, or meal prepping prior to cooking. So just kind of breaking down that task so you are not getting overwhelmed and overdoing it for yourself while you're in the moment there. And then getting family and caregivers involved. This is not always the case for our patients, but definitely just educating them on having them get help when needed, so they're not trying to conquer a task completely all at once. Positioning. So today we will be talking about 2 dyspnea control postures, and that is upright positioning and tripod position. So with upright positioning, during our treatment sessions with patients, we always want to encourage them to sit upright when appropriate. So whether that be if we're getting them from bed to chair, just educating them on the benefits of sitting upright for a few hours versus just lying in bed. However, if they are lying in bed, we want to prop their head up and position them for comfort while they are lying down, so their airway is cleared and they are able to use those abdominal muscles to help them breathe. And with tripod position, this is a common position noted when individuals are in respiratory distress, and that is the photo of me on the right. So kind of be aware of this position, and if patients are showing this sign during a treatment session. But this is good to help with shortness of breath. So this is when the patient's leaning and can be standing with upper extremity supported. So also another time you can see this is when individuals are at the supermarket and they're kind of just leaning their upper extremity on the cart and breathing deeply. Breathing techniques. So one of the techniques we are going to talk about today is pursed lip breathing. So this technique is great for when our patients are experiencing shortness of breath. It helps them release that trapped air that is in the lungs by kind of training themselves to breathe in a regulatory pattern. So how we teach our patients is by telling them to relax their upper extremity. So kind of get all that stiffness out. And then you want them to inhale slowly for 2 seconds. And then you're going to tell them to purse their lips as if they're whistling. And then exhale slowly for about 4 seconds as if you're making a candle flicker. And this is always good to say because you don't want them blowing super hard out. What I used to tell my patients is smell the roses, blow out the candles. This kind of gives them a good visual to kind of follow the technique. Breathing techniques continued. So now we're going to talk about diaphragmatic breathing. So this breathing technique strengthens the diaphragm. It also decreases the work of breathing by slowing down your breathing rate, which also decreases oxygen demand. So these are all good things for our pulmonary patients. And I found this interesting study by Morrow et al. 2016. And with 18 participants, they found improved diaphragmatic muscle activity by utilizing the diaphragmatic breathing technique. So I thought that was great to see it being effective in the research. And on the left here is examples of me completing this breathing technique. So first you want to have your patients lying supine to start. I did see that that was easier for learning. And you can have them prop a pillow under their knees, just making sure the neck is supported as well and they're in a comfortable position. And you want them to place their arm on their chest. So I have mine just relaxing. You can do that as well. And then one below on the diaphragm there to feel your breathing. And you're going to start by inhaling and allowing the diaphragm to expand. So you should see your hand rise there. You can kind of tell on the picture. And then as you exhale, the diaphragm contracts, and then your arm should go, your hand should go down there. So kind of a good visual representation to see as you're completing the technique how your arm should move with your breathing pattern. Medication management. So these are some of the types of medications that our pulmonary patients will be taking, such as inhalers, a nebulizer, oral medication, and an oxygen tank. So these are things as OT practitioners we need to be aware of so we can help them incorporate them into a schedule, setting up reminders, and getting them organized in order to avoid exacerbations and maximize their quality of life. And on the right here are just some examples of how we can educate our patients. So the reminders up top is something that I just created on my phone. So this is something that we can help patients set up. But I said nebulizer treatment at 2 p.m. and that will be a notification that pops up daily. I thought that was very beneficial. And take prednisone at 5, so you can like schedule set different times, and these can pop up daily, and you can put that in the settings there. Or something like use inhaler twice a day. So you can set that up, and they can have all these notifications go off at different times. Also, a pill box, the traditional way of separating oral medication. This can be another good idea to help them manage their medications. Temperatures and allergens. I thought this was interesting. It is something else to consider when educating patients on the best environment to ensure their quality of life. So air quality and temperatures may compromise lung function. So anything that is too extreme, like cold air, even really hot air, humidity, we're very familiar with that in Florida. Wind, air pollution, poor air quality. And I know sometimes these are notifications that we even receive on our phone if you're a part of a weather app. So just educating our patients on those kinds of things that they can look out for. And keeping their home environment free of dust. This may be difficult for some individuals who have a very short tolerance for activity. So maybe educating them on how they can receive services for cleaning or have a family member help them. Also cleaning air filters within the home environment. These are just like AC ducts, stuff like that, and avoiding the use of chemicals. So anything strong like cleaning products, just making sure if they are engaging in these chemicals, to wear a mask and just be protected. Hygiene. I thought this was another good one to put in here to consider with pulmonary patients, as though this goes for all of our patients. According to the CDC, hand washing kills germs and prevents sickness and infection. So how can we protect our patients? So just a lot of education as usual, educating them on good hygiene, always washing their hands, using hand sanitizer, wiping down surfaces, wearing a mask, and staying away from others who are sick. Psychosocial aspects. So I thought this would be a great way to conclude the presentation, as the psychosocial aspect of treatment is so important and sometimes forgotten. So with our pulmonary patients, we definitely need to take into account that they may be experiencing things like depression, anxiety, and denial. When we put ourselves in their shoes, we think of things like their independence being taken away. Now they can't complete some of their meaningful ADLs and IADLs. So how does that affect them mentally, physically, and emotionally? So as OTs, how can we help? So managing their stress, and that can look like a variety of different things for many different people. I included this picture on the left because boat rides and sunsets are definitely my way of managing stress and helping me reset. There may be different things for different individuals, so definitely keeping it client-centered and getting to know what's meaningful for them. And coping skills. So this may look different for many individuals, but it may be taking a short walk or, joining groups with people that have similar, are experiencing similar conditions, or going to a book club, or many different things like that, and practicing good habits. So this reflects a good diet, an exercise program that's fitting for the individual, practicing good hygiene, um, and also just maintaining those pulmonary precautions to uh, experience a good quality of life. And these are my references. Thank you so much for listening today.